We know you've got some worries and concerns about coronavirus. My name is Dr. Trish Fisher and I want to talk to you today about what to do if you're worried that you might have cancer or if you already do have cancer.
Hi, my name is Des Breen. I'm the Medical Director of the South Yorkshire and Bassetlaw Integrated Care System and I co-chair the Cancer Alliance. And I think there's some really important messages we need to get out there for people who are suspecting they've actually got symptoms or signs of cancer.
I'm asking people to help us to help them. And in particular, I'm asking people to continue to look for the signs and symptoms of cancer in the way that they always have. So to take note of any lumps, bumps or changes in their own body, any pain, any blood, anything at all that they're concerned about.
If people have serious worries or concerns or signs and symptoms that they may have a serious disease like cancer, then they should access the normal health care that they would do by going to the GP.
The reason that this is important is that the sooner we find cancer, the better treatments we have and the sooner we can give you those treatments. But also importantly, the sooner that we can reassure you that you don't have cancer, the less time you'll spend worried about this.
It's really, really, really important that you still access the health care that you deserve.
We've made a lot of changes in the way that we work, which are directed at keeping you as safe as possible. So for instance, you might find that some of your consultations with your GP or with ourselves are done on the telephone or via a video chat. But it is still very important that you come and talk to us and share your concerns so that we can decide how best to safely investigate them.
There's lots of healthcare professionals and experts working very, very hard to make sure that the cancer treatment is delivered in the context of the coronavirus that we find ourselves in. So for those of you who have got cancer who are undergoing treatment, it really is important to self-isolate. Under the current climate, you are a little bit more at risk from infection, so it's really important that you keep yourself safe, at home, isolate, and make sure that you look after yourself.
They need to reduce the number of times they leave the house to reduce the risk of getting the virus. Clearly it's still incredibly important that they come for all of their hospital appointments, and now more than ever we would only ask you to come if it's important to do so. We want to thank everyone for working so hard at keeping themselves, others and the NHS safe during this difficult time.
I just can't thank people enough for doing what the advice says and stay at home, washing your hands and keeping safe.
And we'd like to thank everyone in lockdown for working so hard to keep the NHS and each other safe.